certainly nobody wants to feel worse going through a hyperbaric oxygen protocol. However, absolutely, some people do feel worse after their first session or after the first few sessions. Why is that? There are likely to be a few other reasons than the top 3 that I'm naming, but ultimately it's really not common to have somebody feel worse after their session. And so we're talking about a pretty small population size. And in that small population size, these are really the top 3 categories that I would say most of those people would fall into. So let's just take them one at a time. The overoxidized patient. This patient already knows that they're sensitive to EMFs, they're sensitive to radiation. This person may have multiple autoimmune diseases. Their inflammatory levels are very, very high, and they're very sensitive to other supplements and other therapies that they may have tried in the past. When we have a patient like this, putting them at 2.5 atmospheres on 100% oxygen for 90 minutes on their first session is likely going to backfire. What's the rush? If we start a little slower and we expose them to small amounts of hyperbaric, small amounts of oxidation, and we give their body a chance to recover and recuperate from that, rebuilding their body's antioxidant system. We've done a number of videos on reactive oxygen species and hyperbaric, so if you haven't seen those, please take a look. But if we expose this person over a series of treatments to slowly increasing levels of hyperbaric, which also means slowly increasing levels of oxidation, not only will they tolerate our treatments better, but they're actually going to tolerate their environment better. And so by taking our time, we can have them have a really good, positive, healthy experience with their hyperbaric protocol. Within that first category, if you're pushing too hard, how do you know? I think the best way to explain it would be, it's not that it's creating new symptoms that that patient has never had. It's actually that we're just aggravating current symptomatology. Issues or symptoms that they either currently have become increase in intensity, or older symptoms that they used to have start to resurface a little bit. That would be a really good indication that we're pushing too hard. In some cases, and with some patients, you have to know your audience. It's okay to push through that. You know what the benefits are on the other side. And so if you do that slowly and safely, that's a clinical decision that you would have to make in your office. I'm not saying that's the wrong thing to do, but prefacing and setting an expectation like that with your patient would be really important. A lot of those patients don't want to be pushed that hard. They'd rather go slower and feel better throughout the journey. But sometimes they want to be pushed. And again, you have to know who you're talking to, who you're working with, and what the best course of action would be for that person. Within the second category of the autonomic nervous system, these people typically don't feel worse from a symptom standpoint. They feel really fatigued. They feel wiped out. Like they get out of the chamber and they're like, I need to go home and go to sleep. I believe that most of these patients are very sympathetic driven patients. They live in fight or flight. They live in their sympathetic nervous system. Hyperbaric has a very parasympathetic effect on the body. In most cases, that's terrific. Most people need to be brought back into their parasympathetic nervous system. In our parasympathetics, we digest our food better, we sleep better, and then we heal and regenerate tissue more effectively. And so the parasympathetic nervous system is critically important, and so many people are deficient on that side of their nervous system. When you take a patient who's very, very sympathetic nervous system driven, and you bring them back into their parasympathetics, usually they feel exhausted. Now, it's easy for me to say, I think that's a good thing. We're helping to teach that person's body how to operate within the parasympathetic nervous system again. But in those first few sessions, that might feel exhausting. Similar to the first category, perhaps we just want to go slower, build up their amount of time, their frequency, their duration, and their pressure over a series of treatments so that we're not pushing too hard on their nervous system. Or again, if you know your audience well, you can push these people a little harder because it's typically less difficult and faster to push through some of that fatigue than it would be to push through an overoxidized patient. Again, that's very important to know each patient individually and then have these conversations so that they understand. Listen, the reason that you're tired is likely because this chamber is helping to center your nervous system. It's helping to bring you back into your parasympathetics. It's helping shift your nervous system back into the rest and digest, the heal and recover portion of your nervous system, which right now you really need. But again, we have to have those conversations and set the expectations properly. We will get right back to that video, but real quick, there are a number of rules and regulations and best practices that you need to know in order to be safe and compliant and run your practice accordingly. If you're not sure that you've got all your bases covered, we've created a free checklist for you that maps out everything that you need to become compliant inside the hyperbaric industry. You can grab that checklist for free by clicking the link in the description below. And now back to our video. The third category is that chronic infection patient, where as we apply hyperbaric, both because of the high oxygen environment being an antimicrobial agent, helping to kill the infection, as well as the well-known benefits of hyperbaric oxygen increasing our immune system's capacity to fight infection, we start to get a die-off reaction inside that patient. As we're killing the infection, those infections are releasing toxins, and patients can have an Herxheimer or a Herx reaction from that. Similar to the overoxidized patient, that doesn't usually create a whole new series of unexplained symptoms. It's typically a re-exacerbation of symptoms that patient either already has, but now it's magnifying, or old symptoms that they used to have that are resurfacing. Similar to the other cases that we were just talking about, this could be resolved by just going slowly through a transition of therapy, slowly increasing their frequency, slowly increasing their duration, and slowly increasing their pressure so that they're adapting and adjusting to those increased levels of oxygen, so that the speed to which the immune system is improving slows down a little bit. The speed to which the oxygen-rich environment is suppressing those infections slows down a little bit. If we do that slowly and thoughtfully, we can help that patient transition through a series of treatments, improving their immune system function, reducing their microbial load, and ultimately improving their health over time. Similar to the other two cases, you may get the occasional patient that knows what a Herxheimer reaction is willing to tolerate it, and wants to push through it because they know what's on the other side. In those cases, I think it's appropriate to do that as long as you have the conversation, the patient understands the expectations, and you have an open dialogue to understand how that patient is going through their care, how they're tolerating it, being able to back off if need be, and push harder if you can. But again, patient expectations really important. These are all long-term patient relationships. If we push them harder than they're willing or wanting to go, and we break that trust, we're going to have a hard time making sure that they stay long enough to actually get where they're trying to go from a health perspective. Honoring that trust and having open dialogues and those conversations with patients so that they understand what their choices are, what they're feeling and why they're feeling it, and what the best ways to proceed are going to be, establishes stronger rapport, stronger trust with that patient, and increases the chances that they'll stay with you long enough to get to the results that you and they both want. So these are the top three categories of why some people do feel worse after a treatment. Again, typically that's not a long-lasting issue. That's a short-term issue. It's usually the first session, the first 3 sessions, maybe the first 5 sessions. But if you do it the way we discussed and transition people through an increasingly intense course of care up to that patient's tolerance, you should be able to get the results that both of you want, and to do it in a way that that patient feels good through the journey. Thanks for listening, and we'll see you on the next video.